Our first speaker for Proposition is Christopher Snowdon. Christopher is the head of the Lifestyle Economics at the Institute of Economic Affairs. He's also an author and a journalist, having written for the Daily Telegraph, The Spectator, and Spike magazine. Christopher, you have the floor.
Thank you very much indeed, and thank you in particular for holding this debate in the middle of winter, when the ability of the NHS to meet the needs of the people is more apparent than ever. I think the evidence is incontrovertible just from picking up a newspaper, or God forbid if you have to go into A&E. We have 2-hour ambulance waiting times for Category 2 calls on average. 7 million people now on NHS waiting list, 3 million people waiting over 18 weeks for treatment. Cancer survival rates have always been pretty woeful in Britain under the NHS, and they're likely to get even worse now. There are currently round about 1,000 excess deaths a week, and there have been for months. Now, perhaps it is unfair to pick on the NHS this particular winter. Healthcare systems across Europe are struggling for various reasons. It is a very difficult time. However, these other systems do not have a crisis every single winter. The NHS does. It has had all my life. Yeah.
I was just wondering how much you thought your view on the subject was shaped by the interests of the private healthcare companies that pay for your think tank.
They don't pay for my think tank. Which private health? I don't know any. I couldn't name any private healthcare companies other than Bupa. And I certainly don't know of any that pay for the donate towards the Institute of Economic Affairs. If we could stick to the facts instead of ad hominem arguments, many healthcare systems are struggling, but they don't all have a crisis every single winter. The NHS does. It always has had throughout my lifetime. The NHS has been in crisis, in fact, almost since the day it was founded. And there are many problems with the NHS, as I'm sure you'll hear tonight, but one of them is really very simple, and that is it doesn't have enough doctors and it doesn't have enough beds. It's got plenty of net zero delivery managers, plenty of equality, diversity and inclusion directors, but when it comes to the basic building blocks of healing the sick, it is deficient. We have in this country 3 doctors per 1,000 people. The EU average is 4 per 1,000 people. That really adds up when you have 68 million people in the country. We have far fewer CT scanners, MRI units. We have only 2.4 hospital beds per 1,000 people, which is less than half the EU average of 5 per 1,000 people. For decades, the NHS has been making a conscious and deliberate decision to reduce the number of hospital beds available. Gone down from 300,000 in the late 1980s to less than half that, less than 150,000 today. And this has all been done in the name of efficiency, the idea being there's no point having all these hospital beds if they're not all going to get used all the year round. And the fact that at some points in the year, like now, they do need to be used, and there's ambulances queuing up outside hospitals because all the beds are full, that doesn't come into the picture because it's simply more efficient that way. Well, fine, I'm in favour of efficiency, but how efficient actually is the NHS? Total healthcare spending from the government, the NHS in other words, in 2021 was £229 billion. It's more than £4,000 for every man, woman and child. £16,000 total healthcare spending for a family of 4. The Department of Health and Social Care budget has gone from 126 billion in 2008 to 174 billion today in real terms. That's a rise of 40% in real terms since 2008 during the era of so-called austerity. We spend 12% of GDP on healthcare in this country, which is more than Sweden, more than the Netherlands, more than Denmark, Spain, Ireland, Finland, Belgium, in fact, more than almost any other country apart from the USA and Germany. And this is not because of extra spending on COVID, although, of course, it did peak in 2020 and 2021. We've been spending more than the EU or the OECD average for some years now. The NHS is not underfunded. If anything, it's overfunded. We pay premium price for healthcare in this country for a third world service. If you accept, incidentally, the logic of NHS worshippers, we should be paying less for the NHS. The NHS budget should be lower than in comparable countries because they haven't got all those greedy, evil, profit-making companies that you mentioned. Taking money out of the pot. Also, huge economies of scale, you would think, from having just one health service serving the needs of so many people. But this is one, if it's as bad as the last one, I don't think I'll bother. This is one of the great socialist delusions, that if you remove profit, you make things cheaper. It doesn't work with other industries. It doesn't work with healthcare. Why doesn't it work? Because without a price mechanism, without a profit motive, there is no way to allocate resources efficiently. If you allow people, what?
Is the fact that the NHS is overfunded or badly managed not the fault of a Tory government that is
I'll come to that.
play a long-haul plan to privatise the NHS and they make it as bad as possible so that no one cares once it's sold off?
Making something as bad as possible is not normally what people do when they're planning to sell something. Without a price mechanism, you can't allocate resources efficiently. And you see this in the NHS. If you allow everybody in the country to have unlimited GP appointments, you shouldn't be surprised when people turn up to GPs frivolously. And the GP surgeries are full of malingerers and people who just want to have a chat. Similarly, on the other side of the ledger, if you pay GPs based on how many people are on the books rather than how many appointments they keep and how many patients they see, then you shouldn't be surprised when GP surgeries leave people waiting and decide not to employ any more GPs. If hospitals get money regardless of the quality of service they deliver, and if they can never go bankrupt because the government always bails them out, then don't be surprised if you don't get a good service from them. Now, it is often said that the NHS is often or only kept afloat by the goodwill of the staff, and there is a lot of truth in this. And what I'm saying is not in any way to denigrate the people who are working on the front line of the NHS, many of whom are even more unhappy with the system than I have. But without a profit motive to raise standards, you rely on goodwill, and you cannot rely purely on altruism to run an enormous leviathan the size of the NHS. The NHS is the 5th biggest employer in the world, just behind the Chinese People's Liberation Army, which probably doesn't kill as many people. It cannot run solely on goodwill and human empathy. And so it does what other socialist systems have done in the past when they don't have a price mechanism or profit incentives. It creates internal markets, it sets targets, it has top-down orders, which all leads to more and more bureaucracy and leads to GPs and doctors in general having far more paperwork to do than they should do, because people at the top want to know what's going on, because the people at the top get the blame for things even though they've really no idea how the system works. In fact, probably nobody, including the chief exec, really knows how the entire system works. Go on. Thank you. I'll come to the US in a second. Why, for example, if you ring a GP receptionist will tell you that they haven't got any appointments for weeks, but if you ring back the next day at 8 o'clock in the morning, they will see what they can do. You ring up at 8 o'clock in the morning, what happens? The line's engaged because they've told everybody exactly the same lie. And so you ring back and you ring back and you ring back as if you're trying to get tickets for Glastonbury or something. And eventually you might get through and they'll say, actually, we have got appointments. You can come in at 11 o'clock. Why do they lie to you on your first contact with the glorious NHS? It's largely because of same-day appointment targets. And you'd be quite happy with a next-day appointment, but they want to give you a same-day appointment target. The point being, targets are rigged by the people within the system. You cannot rely on targets and top-down orders because people are imaginative and they will find ways of getting around it. And so you end up with a system in which, in contrast to a profit-making industry in which the staff wait for the customers and at least pretend to be happy when they see them, you have the customers waiting for the staff, often for months and months at a time, and the customers, which is to say patients, are regarded as a burden and a nuisance when the staff finally get around to seeing them. The only good thing about the NHS, someone just mentioned the US system, and the reason so many people are devoted to in this country is that it provides universal healthcare coverage free at the point of need. But, ladies and gentlemen, Britain did not invent the idea of universal healthcare free at the point of need. It is not unique in having it whatsoever. Every developed country, with the exception of America, has universal healthcare at the point of need. The NHS is not special in this or any other regard. The great lie that the British public have been told is that in order to have universal healthcare, you need to have the government owning all the infrastructure and running the whole damn thing. The UK has more state-owned hospitals than any country in the world. We have more state-owned hospitals in this country than Germany, Italy, and Spain put together. Significantly more, in fact. And that's because it is not normal, despite what we may think in Little England, for the state to be owning and running nearly all the hospitals in the country. There's no need for it. There never was a need for it. The state doesn't nationalise farmland in order to make sure that people have access to food, and it doesn't need to nationalise the health infrastructure to ensure that people get healthcare. Other countries have social insurance systems which cover everybody, no matter how rich or poor they are, and they get treated by private healthcare providers who operate in a market that incentivises high quality and prompt treatment. That, in my opinion, is what we should move to in Britain, but it probably never happened because we are so parochial. We don't look at how healthcare is provided in any other countries apart from the USA, which nobody wants to emulate. Now, ladies and gentlemen, you may disagree with my prescription, but you cannot disagree with my diagnosis. The question before you today is not whether we should privatise the NHS or whether we should reform the NHS. The question is whether it meets the needs of the people. It is quite obvious, I put it to you, that it does not meet the needs of the people. It cannot meet the needs of the people, and therefore no fair-minded person in this room has any option other than to vote for the proposition.